everybody, I'm Kelsey King with 435 South, and I'm here with Biagio at Elite Fitness, and he's going to tell us some ways for men to prevent back pain.
Thanks, Kelsey. This is Chris, and he's going to be a demonstration person for us. Back pain can be generated from a number of different problems. It could be a muscular issue, it could be a disc issue, it could be any number of things. But essentially how we move and our posture helps us to prevent the onset or the recurrence of back issues. And Chris is doing a pretty good job here, but they will tend to stand with their hips in front and just let their belly kind of come in front. An easy thing to do is just suck the stomach in. Not press like you're doing a crunch, just suck the stomach kind of up and underneath your ribs. That takes a lot of the pressure off the back in standing and walking and lifting, and can really be an easy thing that you can do that's a pretty good preventative measure. Another problem that we see a lot is with lifting mechanics. I think most people have heard, or at least have heard from someone before, that you should bend at your knees and not at your back, which is true. You don't want to just round from your back when you come over to pick something up. But the tendency there is they keep their back vertical and then come straight down. So Chris, when you come down, let's do it in an incorrect way there and throw your knees way in front. Okay, when the knees come out in front of where the feet are, that puts a lot of pressure on the knees, and it doesn't allow the hips to work like they should. And Chris is even doing it better than most people demonstrate. Come straight down and stick your knees way out in front. Many people will kind of get into this crouch position here as they come up, there you go, and are using that as their lifting position, but that can put a lot of strain on the back as well. Instead, what I'm going to have him do is stick his rear end back out behind him, go ahead and come back as he's sucking his stomach in, and so if he was going to lift something up from there, he's got his rear end back far enough and has got his gluteal muscles engaged. The knees are back behind the toes, so it's protecting the knees. And he's in a really good position here to lift something with a lot of power. Okay?
And what kind of things do you do here after these problems have occurred?
Well, a lot of times it's just instructing people on mechanics to correct some of the mistakes that they have been doing. But there's a number of things that we can do treatment-wise that can help to alleviate back pain. There are manual therapy techniques where we put our hands on the patients and help to alleviate pain and improve posture, improve mobility that way. There are a number of different exercise techniques that we can use.
Well, thank you, Biagio, and that's been our segment for 435 Fit.